I saw a lady that is trending on the internet. I think I saw it on Insta blog, where this lady was questioning the dad. She was practically angry with the dad that the dad went ahead to do this female genital mutilation that they call female circumcision on her, and she was not aware. So during the conversation, the girl was questioning the dad. Why did the dad not tell her about it? So the dad's response was like, I expected you to know because there are a lot of information on the internet about it. So that was the dad's question. It was like, oh, I expected you to know about feet. I expect you to have the idea. But to this girl, she is not aware. She doesn't know what signs to actually show that she's circumcised or not. See, I think she had this conversation with her dad to confirm maybe her doubts or something. So, good day everyone, and welcome back to Nurses Lecture Room YouTube channel. My name is Miss Mary, popularly known as a nurse with a difference, and I make learning easy and accessible for all my viewers. Today, I'm going to be sharing with you how to know that you as a lady is circumcised or not. The signs and symptoms, what you will see that will make you feel that will make you know you are circumcised or not. Okay, but before we go into details into this class, if you are new on our YouTube channel and these are content you are interested in, please click on that subscribe button, turn on that notification bell so you don't miss out. For all my returning subscribers, this is Nurse Miss Mary saying thank you. Let's go there. All right, welcome back. Now let's talk about circumcised and uncircumcised lady. That's a popular word for it, but the real name is actually female genital mutilation. And like I earlier said, most ladies have had female genital mutilation without knowing that they have female genital mutilation, which they call female circumcision. So the first thing I would like to tell you is that if you are from African origin, if you are from places like Afghanistan, Iran, where there's an increased incident of circumcision, that should program your mind to start doing some checks and to know if you are circumcised or not. I'm not saying all Africans are circumcised or something. So having a history where that is being done, there could be a possibility that it was carried out on you. Okay, so that is the first thing you should do a check on. Where are you from? Do they normally practice? Do they do this practice back home? Do they do this practice where your parents circumcised? So that should give you an idea of, okay, should I continue with this video to find out if I'm circumcised or not? So find out your history, find out if it's done back home where you are from, and that gives you an idea. That is one. So the second one I would like to share with you is exploring your female genitals. Yeah, exploring your female genital. Looking at the female genital, we have the labia majora, we have the labia minora, and we have what we call the clitoris. So if you have a picture, now it's time for you to explore yours. You can use a mirror to do that. Make some comparison. Check if you have your labia majora. Check if you have your labia minora. Check if there's a presence of a clitoris. You can see what's in the picture. Just try as much as possible to make a comparison and see if those things you see in the picture as of female reproductive organs are there. Because depending on the category of circumcision, sometimes the clitoris is removed, another the labia majora is removed, the labia minora is removed, depending on the severity and how far they can go. That is how far you can actually see if you were circumcised or not. So you have to find out if that clitoris is there. So the best way you can do it after knowing your history is to make a comparison with what you see in a picture of a female reproductive organ. So I have a picture showing on the screen that shows women are born with labia majora, labia minora, and also a clitoris. So have a comparison and check down there. Do you have all this complete? If one or two is missing down there, that could be that circumcision went on when you were younger. And also check your genitals. Do you have scars? Do you have any form of a scar there? You know, when you cut something off, there's going to be a scar there that's going to be like forever. So check if you have any scar. So if there is a scar down there, that could be a sign that you were circumcised. So basically, these are the three main things I want you to take note of when it comes to checking if you as a female is circumcised or not. But in general, there are some long-term effects, long-term complications that are likely going to arise from being circumcised. And I'm going to be sharing this in this video. So if you see one or two of these complications, that may be because you were circumcised when you were younger. The first one I have to share with you is problem with urination. This person might be having painful urination, might be having frequent urinary tract infection. That is one of the problems associated, the long-term effect of female genital mutilation, which is the female circumcision. Then another is vaginal problems. These people might be having frequent vaginal discharges. These people might be having itching, bacterial vaginosis. They might be having other kinds of infection because of the way the whole circumcision process went through. They might be having menstrual problems. They might be having scar tissues and keloids, which I already said. Sexual problem. They might be having pain during sex and decreased satisfaction. Pain during sex and decreased satisfaction. Remember, one of the major reasons why circumcision was done back then, because they feel it's going to reduce promiscuity. It's going to make their ladies not to be promiscuous, but it makes them it will help them to be virgins before they meet their spouse. So that sexual satisfaction might not be there if you are circumcised. I'm not saying all those that are not circumcised are not going to have sexual satisfaction. Then another is increased risk of childbirth complications, need for later surgeries. So these are just the long-term effects I wrote here and I've shared with you about female genital mutilation. But I want to let you know that in the UK, it is illegal. Even in Nigeria now, in most countries these days, it is illegal for you to circumcise your female child. It is illegal. In the UK, if you are caught performing this female circumcision, I think you are going to be performing 14 years imprisonment. If you are caught not protecting this child, not protecting the female child, you're going to be spending 7 years in the prison. So it's a big offense. It's a big criminal offense that like they don't joke with. It is illegal. In Nigeria, it is illegal. Though in some communities, they still do that. But just know it is illegal for you to circumcise a child. Then I want to let you know that more than 200 million girls and women alive today have undergo FGM in 30 countries in Africa. So more than 200 million women, ladies that are alive today have undergone FGM. So if they have undergone FGM, there's a possibility that the children they are going to give birth to, they might make them undergo FGM. But thank God for social media. Thank God for publicity, enlightenment, health education. People are able to know the dangers of involving in FGM and all the things inclusive. All right. So female genital mutilation is not what is encouraged and is not what I personally encourage. So practically, this is what I have to share with you about FGM and how to know that you have been involved in FGM. So if this video was helpful, kindly drop on the comment section. I will really appreciate. Thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got a value. For all my returning subscribers, this is Nurse Messi Mary saying thank you. Bye and see you in our next video.